Hello friends, today the 24th March is commemorated as World Tuberculosis Day because on this day in the year 1882, German physician Robert Koch has invented the bacteria what we call today as Mycobacterium tuberculosis. Prior to that, people were dying with tuberculosis without any treatment. Subsequently, the treatment of tuberculosis was only sanatorium, good fresh air, good food, people were isolated. And it was only in the 1942 that the first drug for tuberculosis, streptomycin, was invented. Subsequent to that, it was realized that when you give streptomycin to the patients with tuberculosis, they develop resistance. And more drugs were developed over a period of time, and the treatment of tuberculosis became sanatorium with 18 to 24 months of treatment. In 1970, new drug called rifampicin came to India. With that, the short course tuberculosis treatment for 6 months came into a reality, and this is what is being practiced today. Unfortunately, despite availability of good diagnostic facilities and the treatment for tuberculosis, the tuberculosis continues to be a serious menace to the mankind. 1/3 of world population is infected with tuberculosis. They may not suffer from it. And 40% of the Indians, adults, are infected with tuberculosis. India has the distinction of having 1/7 the world population, but 26% of Indian population, 26% of tuberculosis occurs in India, and it causes 3 to 4 lakhs of death every year. Why this is so, despite availability of diagnostic facilities and free treatment? This is because that there is lack of awareness about the tuberculosis. The tuberculosis presents with symptoms of fever, cough, sometimes spitting of blood, tiredness in the evening, night sweats, and weight loss. 80% of the tuberculosis occurs in the lung, and 20% of the tuberculosis occurs outside the lung, which could be lymph node, which could be heart, which could be brain, which could be bones, which could be skin. What I mean is any part of the body. The diagnosis of tuberculosis is very easy, generally with the sputum examination under the microscope. But there are biotechnological based tests also, what is called gene expert, in which the diagnosis can be achieved within 2 hours. Despite availability of good drugs, unfortunately there is a genesis of what we call as MDR-TB or multi-drug resistant tuberculosis. This is a very serious concern as far as TB is concerned. The question is, why does it develop? Whenever the TB treatment is incomplete or irregular or insufficient, then these TB bacilli tend to be resistant. As on today, about 10% of TB cases are MDR-TB. Usual treatment of TB is for 6 months, but MDR-TB requires specialized treatment. Previously, we used to treat it for a period of 18 to 24 months, but with the development of new drugs, now it is possible to treat it by giving treatment for a period of 9 months. Government of India has provided free diagnostic and treatment facilities to even the farthest spread place in the rural area where the facilities for diagnosis and treatment are freely available. The treatment of MDR is done at a specialized centers that is also with free of cost. Our Honorable Prime Minister has pledged to end the TB by 2025. This can be achieved only with the understanding and awareness and the cooperation of every citizen of this country. So let us take a pledge on this day that we'll all get together and end the TB by the year 2025. Thank you.